Hi there. Are you somebody who's wondering if you might be gluten sensitive or maybe considering eliminating wheat and other grains from your diet? Are you trying to troubleshoot problems with low energy, joint pain, fatigue, chronic fatigue syndrome, fibromyalgia? If so, you may find this video interesting. Hi, my name is Dr. Richard Matthews. I'm a board-certified chiropractic neurologist, and today I'm going to be reviewing a test called WheatZoomer and discussing what gluten sensitivity is and the best way to test for it. So to dive into this, we're going to look at the difference between conventional knowledge of gluten sensitivity as it relates to whether or not you have celiac disease or just non-celiac gluten sensitivity. It can be almost as bad, so I don't want to downplay it, but it is different. Now, normally, celiac disease is actually diagnosed by a biopsy of your small intestine, which is a somewhat invasive procedure to do, but it's also often done after a gluten challenge, meaning you have to have eaten gluten in order to create the problems that the biopsy is going to look for. Non-celiac gluten sensitivity is diagnosed with lab work and not with biopsy. Although, as you'll see later, if we were to do biopsies, there would certainly be some findings. Anyway, what is gluten? Gluten is a protein that is in wheat and anything, or many things at least, that are made out of wheat. It's present in some products like barley also, barley malt, but mostly we're going to be talking about wheat. Now, when I first became aware of gluten sensitivity and what gluten is, we had lab tests to look for immune reactions to gluten and just gluten or just wheat allergy. And at that point, I had a lot of problems. I had a lot of joint pain, a lot of fatigue. Really, by the end of every day, busy day seeing chiropractic patients, my hands were extremely painful. So, like maybe some of you watching this, I was actively trying to solve a problem. And I, at that point, had been eating a lot of wheat into making my own bread, and had a bread machine and using natural grains and ancestral wheat and all that type of thing. So I thought, gee, that's one of the things I changed. Maybe that has something to do with my hands changing. So I decided to try just cutting out all wheat. And within about a month, my hands felt much better. And after reading about that, I realized there was a thing called gluten sensitivity. So I did a food sensitivity panel and found out I was not sensitive to wheat, and did a gluten sensitivity test, which was one of the earlier tests, not the one we're talking about today. And it did not show that my immune system reacted to gluten. But if I tried to eat it again, of course, all the problems came back. So I knew, well, one way or the other, I can't eat gluten. Years later, I found this test, or technically they found me. Now, I should disclose at this point, I'm a functional practitioner and I use WheatZoomer as a test clinically to help patients. So this is informational. You're welcome to just watch the video and learn something. Or if you would actually like to do this test, I am one of the people that you can get this test done through. And there'll be links and description in the description to show you where to go to do that. Now, the difference between a conventional gluten sensitivity test like I initially did, and those are still on the market, I won't name the other companies. The difference between that and this test is that the WheatZoomer test zooms in, as the name might suggest, and looks at not just whether your immune system reacts to wheat or if it reacts to gluten, but also if your immune system reacts to the things that gluten breaks down into. And that is a whole other subject when you really, really look at it. So let's zoom in a little bit and look at it. So the test does cover some celiac disease antibody responses, and these are very suggestive of celiac disease. If you have positives here, it means you probably have celiac disease. And nowadays, I'm not sure if everybody would necessarily need to have a biopsy done. I mean, if you react badly to gluten and you're positive on this, you have celiac disease. It's really a bad idea to just load up on gluten so you can get a positive test result, because some of the damage it causes may not be reversible. Now, intestinal permeability, which when it's increased is also known as leaky gut syndrome, this part of the panel looks at the markers for leaky gut syndrome, increased intestinal permeability. Then transglutaminase, and we're looking for antibodies to this, which means that you have a gluten-mediated autoimmunity. Interestingly, some of these antibodies like transglutaminase 6, TGT6, TTG6, those cross-react with brain and nervous system. So very often that sensitivity also affects how a person feels mentally and emotionally. It may cause depression, it may cause anxiety, but there's often a brain-based connection there. Then we look at the gliadins or gliadins, however you're supposed to say that. These are different proteins that wheat, gluten, is made out of. So if you took gluten and you start digesting it, it releases all these molecules, and your immune system may not like these molecules, so we're looking for antibodies to these gliadin molecules. Now down here, we're looking at an IgE, immunoglobulin E sensitivity, which that part of the immune system, this would actually be a true allergy and not a sensitivity to wheat. What is the difference, you might ask? The difference between a sensitivity and an allergy? The difference is really that we're talking about different parts of your immune system. If you have a wheat allergy, you may break out in hives, your tongue may swell, you may get anaphylactic reactions, as we call them. If you have one of these other parts of the immune system, IgG, IgA reactivity, what we're talking about there is inflammation, maybe inflammation in the gut, it may be throughout the body, it may be in mucous membranes, respectively. But we're looking at a far, far more detailed analysis of whether your immune system is reacting to the byproducts of gluten digestion, the actual peptides that it breaks down into. And I think you can see that is far, far more sensitive. So let's take a little bit of a closer look at my results. When you look at my lab work, this is going to show the pre and the post. And at first, there's a summary page here. And then we look at the individual factors. And this is my own lab work, so I can share it. I like it better than sharing the sample lab work because, hey, it's my story. So here we're looking at wheat allergen IgE, and you can see this is in the green, and it was previously in the green. So I'm not allergic to wheat. And then celiac disease, well, guess what? I did not have it before, and I don't have it again. You can see in the right-hand column here, these results were from 3/28/2018, so March 28th. And the current date on this test was 12/11/2020, so a little less than 2 years later. Now here, transglutaminase or TTG fusion peptides were okay there, still okay. When we look at leaky gut, you can see in my previous columns that I had quite a bit of leaky gut because I had two of these values very much in the red back in 2018. And in 2020, only one of them and only in moderate. Same thing with the transglutaminase part of the panel. I had one of these values in the yellow, and now they were all in the green in the second test. But look at the components of wheat. Wheat germ, for example, this was very high and normal. And then when you look at the gliadins, the actual what gluten breaks down into, you can see what I'm talking about. I had 4 of these guys that were very elevated in 2018, and only one is still elevated in 2020, and one slightly elevated here in the yellow. It's just barely in the yellow. I'm still working on this one over here, the gamma gliadin IgG. I think that one may just come down a lot slower. If you're wondering what I did between this part and this part, it was a complete radical restructuring of my diet. During this episode in 2018, I had for over 10 years been on a gluten-free diet, but was eating gluten-free bread, gluten-free pastas, what I call gluten-free substitution foods, things like gluten-free pancake mix and that type of thing. And, well, you can see how well that turned out. When we look at the non-gluten wheat proteins, we get another interesting issue here. So non-gluten wheat proteins are other proteins in wheat besides gluten. See, wheat is a very complex grain, and through generations of selective breeding and probably some modern day GMO, selective breeding is sort of like old school GMO if you think about it. It's a very complex protein, and there are several proteins in wheat besides gluten. And you can look at this and see all 5 of these I had inflammatory IgG reactions in the past in 2018, and none of them in 2020. So I did a much better job avoiding wheat. But the fact that all these were in the red, despite how careful I had been for 10 years, really tells you that you have to do some fairly radical things to get gluten completely out of your diet. So that brings me to the issue of gluten-free diet adherence. When I work with patients about the issue of say one of my patients tests positive for this gluten sensitivity for a wheat zoomer. So the recommendation is you have to cut gluten out of your diet. Quite a few patients will say things like, when I say, well, how's that going? Well, I'm mostly there. I'm mostly gluten-free. I only cheat now and then, or I only had a little gluten, or I think I'm gluten-free, but I'm not sure. And, I can easily ask, well, did you go out to eat or not? It's very hard to be completely gluten-free when you eat out without making some very specific choices. And sometimes when we unpack that and say, okay, describe to me your gluten-free strategies. All right, you went out to lunch yesterday. Where'd you go? Okay, I went to Subway. This is an actual case, one of my patients. All right, what'd you get at Subway? Did you get a salad? Well, no, I got a sub, but I just took the bread off and just ate what was inside. Well, let me tell you, when you go back here and you look at this kind of thing, this is what you're getting, okay? When you see these exposures in somebody who's not eating any wheat, well, they're still eating some wheat. Where is it coming from? It comes from this type of exposure. Oh, I took the bread off the sandwich. Well, it's not gluten-free if it's been in contact with gluten. We're talking about a molecular level of avoidance here. This has been looked at in detail, and gluten-free eaters unknowingly consume up to 5 times more gluten than what is considered safe. So there are a lot of things to consider there. One of them is that just because a food is labeled gluten-free does not mean that it actually is gluten-free. So if you look at a steak or a potato as a raw ingredient, it's gluten-free because it never had gluten in it, and it wasn't made in some place that makes gluten. But when studies have looked at gluten-free substitution foods like gluten-free bagels, gluten-free breads. For one thing, the labeling for it to say gluten-free, it's still allowed to have like, I think it's 20 parts per million or something. There's some tiny amount of gluten that's still allowed to be in it in order for it to get the gluten-free designation on the label. And your immune system may actually detect that level. So, you know, when you look at my lab work, that may be an example of that very thing. The relationship, this is an actual research study on the National Library of Health and published in the journal Nutrition. Is it gluten-free? And what this really concluded is right here. Self-report measures don't account for the possibility of unintentional gluten ingestion, overestimate gluten-free diet adherence. It means people that think they're following a gluten-free diet were not really even able to correctly identify foods that are gluten-free in this study. And even people who thought they were strictly sticking to a gluten-free diet were really not. When you compare wheat zoomer and testing for gluten sensitivity this way with food sensitivities, my case is a good example, and Vibrant Wellness itself has shared a patient example here. When they looked at this person, their food sensitivities displayed no food sensitivities, and that was including wheat. It's actually just like mine. But when they did a gluten sensitivity test with the wheat zoomer panel, they found lots of problems. So this is sort of an example of mine. You might wonder what sort of test technology Vibrant Wellness uses. I'm not quite enough of a nerd to understand all this, but they basically do their testing on microchips with proprietary technology, and it's been tested and validated to have extremely high sensitivity and specificity. Now, sometimes when I talk with my patients about gluten sensitivity, the issue comes up of them having mentioned it to their medical providers. If you are a medical provider, cover your ears or please accept my apologies. You're probably not one of the ones that I'm talking about. What we know is that many medical providers simply do not believe that non-celiac gluten sensitivity exists, that it's a thing. Because roughly 3 out of 4 of my patients that mention it to their providers, that's the answer they get. Now, you don't have celiac disease, you should be fine eating wheat. Even though they've got test results from a lab, a lot of doctors will look at that and say, well, I never heard of that lab. It's not my lab. I don't believe it. You don't have celiac disease. You're fine. So I wanted to take a moment and address the fact that non-celiac gluten sensitivity has been a recognized entity, a disease condition in the research literature for years. Well, this very first test is not for years, but some of the other ones I'm going to show you are. Histopathology. What that means is changes at the cell level in non-celiac gluten sensitivity. And this test showed something called lymphocytes and IEL counts. So that is lymphocytes that are in part of your intestinal lining. And they identified that right on a research study. T helper lymphocytes and mast cell immunohistochemical pattern in non-celiac gluten sensitivity. This test is from this research paper is from back in 2017, talking about the actual changes in intraepithelial lymphocytes, IELs. That's it right here. So here they're actually talking about if we were to do intestinal biopsies on people with non-celiac gluten sensitivity, what would we see? And this is what they see: an increased level of IELs. They're actually saying that this combination of increased CD4 and CD117, which are antibodies, and intraepithelial lymphocytes could actually be useful to support a clinical diagnosis. Well, to me, that's nice from the point of view that showing that this is a recognized entity in the research community. I'm never going to suggest a biopsy for a patient when I have a wheat zoomer test. And wheat zoomer is done with just a finger prick and like 5 drops of blood. Here's another research study. This one's from 2013. Mucosal cytokine response after short-term gluten challenge in celiac and non-celiac gluten sensitivities. What did they find? Non-celiac gluten sensitivity patients had increased density of intraepithelial CD3 T cells. Basically, they found that the immune system was reacting to the gluten through biopsy. Here's another one from 2018, similar finding. And they're saying it's a potentially useful as a diagnostic approach. But again, we already have a way to diagnose it. Excuse me. This is a presentation that I found online, which is The Extremes of Celiac Disease by Marie Robert, an MD, professor of pathology and medicine at Yale. And I won't go through this entire thing, although you're welcome to find it and nerd out on it. I can even leave a link in the description if somebody wants it. But I just wanted to share that he says gluten elimination is therapeutic, but not necessarily diagnostic. Although in the real world, if you eliminate gluten and you do a lot better, you should probably stay off of gluten. He is providing some validity for the entity of non-celiac gluten sensitivity here by saying that there are manifestations, and I just showed you some of those in the research, caused by gluten ingestion in people without celiac disease. So there are some descriptions of it here with actual slides of the intestines. So what does that mean? It means non-celiac gluten sensitivity is a real thing. You can have gluten sensitivity, be sensitive to gluten without celiac disease. We have a great test for it. It only involves a finger stick. It's not very expensive. You do the sampling right at home and mail it in. And you get results within about 2 weeks. It's an extremely detailed test. If you have more questions, I'm going to leave my contact information in the description so you can reach out and ask your questions. I also do online consulting through Zoom or email or on phone. Should you want to follow up in a more detailed basis and get my personalized help to help you figure out how to solve your particular problem. So I hope you found this helpful, even though it's detailed and it's nerdy. You now know, if you made it to this point, quite a bit more than you did before about wheat sensitivity and gluten sensitivity and how to test for it. If you like this video, please give me a thumbs up. And if you want to see more such things, you're welcome to click on the subscribe, and I will try and provide more content. If you have any suggestions, if there's something you'd like to see me talk about that's related to health and lab testing in this sort of problem, feel free to leave a comment in the comment section, and I'll look at doing that. Thank you.